Hello, my name is Dan Trongone, and I'm a wellness coach with ACI Specialty Benefits. And today we're going to be talking about preventing skin cancer. So let's begin. Our skin has many different functions that helps keep our bodies healthy. For one, our skin acts as a barrier to pathogens and protects our internal environment from the external environment. Our skin is also very active in sensation. Our skin contains numerous nerve endings that are sensitive to pressure, temperature, pain, and vibrations. Our skin is vital in temperature regulation as well. It is responsible for cooling the body when we get too warm through radiation, convection, and conduction. When our bodies become too cold, our skin helps conserve the heat by reducing blood flow it receives. Our skin is semi-impermeable to fluid loss, which is what keeps us from dehydrating. Another important function of the skin is synthesis. Our skin has the ability to create certain substances that are essential for our health. Our skin is able to take the UV rays from the sun and convert them into vitamin D to help our bones. Finally, our skin acts as a water-resistant barrier which prevents us from washing out all our essential nutrients. It is well known that sun exposure can lead to skin cancer. So why do so many people sunbathe? Many people believe that being tan increases their attractiveness and gives them a healthy glow. The truth of the matter is that dark, golden color of a suntan is actually your skin's reaction to the sun-damaging UV rays. The American Cancer Society believes that the healthiest color of your skin is the color you were born with. When exposed to UV rays, your skin produces melanin. Melanin is a dark pigment whose main role is to protect the skin from UV damage. Melanin is the equivalent of SPS 4. However, this tiny protection doesn't kick in until after the damage has already been done. Additionally, the amount of melanin a person can produce is genetically determined. Those people with fair skin produce less and are at higher risk of skin damage. It is well known that sun can damage our skin. However, it's important to note that this damage over time can have severe consequences. The sun emits ultraviolet rays, or UV rays. These rays are invisible but are very powerful. Only UVA and UVB rays actually reach the earth. They have the ability to penetrate deep into the skin and cause a number of problems such as wrinkles, sunspots, eye damage, sunburn, and ultimately skin cancer. Many people have experienced the unpleasant symptoms of a sunburn: redness, pain, burning, itching, swelling, headache, and even fever. But what is happening physiologically to cause these symptoms? Once your skin has produced all of the melanin that it can, the sun's UV rays begin to physically burn your skin, causing redness, swelling, and pain. When these burns occur, this is an increase of blood flow to that area in an attempt of the white blood cells to repair the damage. This is what causes the excessive redness. These burns may even blister. If this occurs, your risk of infection can increase due to the break in your natural barrier to the pathogens. Within a few days, your body will try to heal itself by peeling. This is your body's attempt to get rid of the dead skin cells caused by the sunburn. But this does not mean that the damage is over. Enough sun exposure to cause a sunburn is more than enough to cause damage to your skin's DNA. The UV rays have the ability to penetrate so deep that they can cause damage to the DNA, enough to cause skin cancer, melanoma, and other skin diseases. Many people forget that UV rays have the ability to damage our eyes as well. This could be because the damaging effects aren't as noticeable as they are on our skin, but they should not be disregarded. UV rays can penetrate deep into your eyes and damage our retinas as well, which is the thin tissue layer lining the back inner portion of our eyeball. Too much damage to the retina can lead to macular degeneration, a blurring of your central vision. UV rays can also damage the lens of our eyes, which is the part of our eyes that helps us focus. Excessive UV exposure to the eye can lead to clouding of the lens and eventually cataracts. It is important to wear UV-resistant sunglasses when you are in the sun. The darker the glasses does not necessarily mean they are more UV-resistant. In fact, some dark lenses may even allow your pupils to dilate while still letting in the damaging UV rays, thus increasing the exposure to your eyes. So make sure that when you are purchasing sunglasses, they say that they are UV-resistant. Excessive UV ray exposure can cause aging of the skin. This occurs because the UV rays penetrate deep into the skin's surface, damaging the collagen. Collagen is a protein responsible for our skin's firmness. When this protein is broken down, it cannot be resynthesized and the skin will lose its firmness. Excessive sun exposure also leads to sunspots. These are dark patches or freckles on the skin. They typically occur on the chest, arms, legs, and face and are a certain indicator of skin damage due to UV ray exposure. According to the Skin Cancer Foundation, approximately 90% of the skin aging is directly related to sun exposure. Research demonstrates that overexposure of UV rays is directly correlated with an increased risk for skin cancer. The sun-damaging rays penetrate deep into the skin surface, damaging the DNA. This damage leads to uncontrolled cell growth, which leads to cancer. Skin cancer is the most common form of cancer in the United States, and 1 in 5 Americans will develop this cancer within their lifetime. There are different forms of skin cancers. These are basal cell carcinoma, squamous cell carcinoma, and what's called melanoma. Basal cell carcinoma is the most common form of skin cancer and the most common form of cancer in general. It affects roughly 2 million Americans every year. It is caused by UV rays damaging the deepest layer of the epidermis, which is the top layer of your skin. The cancer is typically preventable with limited sun exposure and increased use of sunscreen, specifically SPF 30. Squamous cell carcinoma is the second most common skin cancer behind the basal cell carcinoma. The squamous cells are the cells that make up most of the skin's upper layers and are frequently penetrated by the sun's rays. Squamous cell carcinoma can occur on any part of the body, including mucous membranes, but is more frequently seen in areas that are exposed to the sun. This type of skin cancer is seen 2 times more frequently in men than in women and typically appears after the age of 70. Squamous cell carcinoma is caused by excessive sun exposure and can be prevented if protective measures are taken while in the sun. Melanoma is the most severe form of skin cancer. If it is diagnosed early, it is almost always curable. However, if it manages to progress, it becomes difficult to treat and may be fatal. According to the Skin Cancer Foundation, 1 person dies of melanoma every hour. It is imperative to protect yourself from the sun's harmful rays every day. Melanoma originates in your melanocytes, which are the cells that produce melanin. Melanomas are typically black or brown in color. A person's risk for developing melanoma depends on multiple factors. Primarily, the amount of sun exposure can greatly affect the risk of developing this cancer. The Skin Cancer Foundation reports that a person's risk doubles if he or she had more than 5 sunburns in their lifetime. As previously mentioned, sunburn damage the skin's DNA, resulting in abnormal cell growth. The number of moles that a person has on their skin also can determine how severe their risk of developing melanoma is. Whether normal moles or atypical moles, the greater number of moles, the greater your risk of developing melanoma. Skin type is also a significant factor in melanoma risk. People with fair skin and light eyes and hair are typically at highest risk. However, as the basal and squamous cell carcinoma, people with darker features are still at risk and need to be careful in the sun. About 1 in every 10 people who develop melanoma have a family member who has had the disease. If you have a family history of melanoma, it is imperative that you practice safe sun habits and get skins checked regularly by your doctor. When self-checking your moles, it is important to remember your ABCDs: asymmetry, border irregularity, color, and diameter. Also note that if any of your moles change in any way, you should go to your doctor and have them checked out. Anybody who has a history of unprotected sun exposure has an increased risk for skin cancer. However, it typically occurs in older people. This is most likely a result of many years of unprotected sun exposure. However, research shows that more and more people in their 20s and 30s are now developing skin cancer. An increased incidence of skin cancer has been seen in those who work outdoors and those who sunbathe recreationally, either outside or in tanning beds. People with fair skin, red or blonde hair, and green and blue or gray eyes are typically at higher risk. This could be because these people genetically produce less melanin than those with darker skin. However, it is important to keep in mind that those with darker features are at risk too and should still participate in safe sun practices. So what are some of the warning signs of skin cancer? Any non-healing open sore that lasts a few weeks is considered a sign of early basal cell carcinoma. The sore may heal, but will begin bleeding again soon after. A reddish pink, red-brown, or black bump can indicate skin cancer. It may be translucent as well. An abnormal pink growth with a crusted center and elevated border could be a sign. And also a scar-like area can be a sign as well. It will appear waxy and can indicate roots, which means a larger tumor may be underneath. If any of these signs are present, it is imperative that you get them checked out by a dermatologist. So what can we do to protect ourselves against skin cancer? There are many practices we can participate in to decrease our cancer risk. Primarily, it is important to avoid excessive sun exposure. The less time we spend in the sun, the less rays can penetrate our skin. The sun is at its strongest between 10 a.m. and 4 p.m., so if possible, avoid excessive exposure during these hours. However, being in the sun is not always avoidable and is actually a part of many enjoyable activities. So what can we do to protect ourselves while in the sun? One tip is to wear a hat. Many people forget that our scalps are made of skin as well and are susceptible to sun damage. A hat can also provide some shade for your face. As previously mentioned, it is also important to wear UV-resistant sunglasses to protect your eyes as well. Also, always wear sunscreen with SPF 30 and make sure to apply it liberally. Sunscreen should be applied 30 minutes before going outside and should be reapplied every 2 hours while you are in the sun. If you go into the water or are sweating, it should be applied every hour. Tanning beds have been classified by the FDA as Group 1 carcinogens along with cigarettes and solar UV radiation. The Skin Cancer Foundation notes that people who tan indoors are 74% more likely to develop melanomas than those who have never tanned inside. Many people use tanning beds to acquire a base tan before going on vacation. This method has not been proven effective. The skin is still receiving excessive amounts of damaging UV rays. Our skin is very sensitive to UV radiation and can change rapidly. It is important to get moles checked annually. However, if you have not noticed any changes on your own, you should make sure to call your doctor immediately. Tanning beds have been classified by the FDA as Group 1 carcinogens along with cigarettes and solar UV radiation. The Skin Cancer Foundation notes that people who tan indoors are 74% more likely to develop melanomas than those who have never tanned inside. Many people use tanning beds to acquire a base tan before going on vacation. This method has not been proven effective. The skin is still receiving excessive amounts of damaging UV rays. Our skin is very sensitive to UV radiation and can change rapidly. It is important to get moles checked annually. However, if you notice any changes on your own, you should make sure to call your doctor immediately. One final tip is to watch for the clouds. Up to 90% of the sun's rays can be passed through clouds. Typically, we are cooler when clouds are present, too, so we may stay outside longer. So make sure you apply sunscreen on cloudy days as well. While skin cancer is one of the most common cancers in America, it is also easily prevented if you follow safe sun practices. Follow the tips that you have learned from this presentation, and you will be able to enjoy your fun summer events while staying protected from the sun's harmful rays. For more information on skin cancer and prevention, you can log on to these websites. Now, thank you for watching this presentation. If you have any questions for more information on this wellness topic, please contact ACI at 1-800-932-0034, or you can email ACI at askthepros@acispecialtybenefits.com. Thank you very much.